Pediatrics. I'm a child specialist at Santa Cruz area in Mumbai, Maharashtra. So please let me know if you have any questions related to your baby. I will try my best to answer. So I understand the most important question, which is also a very big answer, is that how should we take care of a newborn baby, which you are asking, Preeti. So of course, when a new baby comes home, it's a matter of celebration. Everybody is happy in the family. The mother is happy. But please remember, the mother is going through a lot of hormonal changes, and therefore it's very important that the mother learns to take care of herself first. Only then she'll be able to take care of her own newborn baby. So babies, as you know, the first 6 months are exclusively dependent on the mother, because they can only breastfeed in this period, and therefore the mother should have enough breast milk. The milk production starts from the first day as soon as the baby is born. The first few days it may be a little less, but then it goes on increasing. So please remember, as much as you make your baby latch to your breast, that much amount of milk will go on increasing as and when you feed the baby. We generally encourage demand feeding. So please make sure whenever your baby is crying for feed, you can latch the baby onto your breast. The process of feeding can go on for about 20 to 40 minutes. Please remember, the baby should take at least 6 to 8 feeds in a day. Slowly, as your milk goes on increasing, you can try and feed on one breast at a time, and the next breast the next time. Please remember to burp the baby after every feed. Now, the baby will be passing urine and stool at frequent intervals. So it's your responsibility to make sure that the baby passes good amount of urine, that is at least 6 to 8 times in 24 hours, because that is the only way for you to be sure that you are feeding your baby adequately. Don't keep a watch on the stool count, because the stool count keeps on varying. It may sometimes be 6 to 8 times every day. It may be once in every 3 to 4 days. So the stool is not a very good way to make out if your feeding is adequate or not. The other thing about newborns is you need to learn to hold the baby properly, and latching the baby properly on the breast is important, because only then the baby will be able to feed comfortably. The baby passes urine and stool, so make sure you are well versed with the process of cleaning the baby. If you want, the baby's skin is not sensitive, you can also use diapers, which are easy and friendly with your baby's skin. Make sure the baby does not remain in a soiled diaper for too long. You can keep the baby tied or wrapped up. And in room temperature, if the room is hot, you can also keep the air conditioner on, provided your baby is full term and is normal and is good weight. About 24 to 25 degrees temperature is allowed. There is no need to keep the room very hot or humid. So in general, these are all the things that you need to do for taking care of your newborn baby. Now Rachna is asking, how often should I give a bath to my newborn baby? So once or twice a day is good enough. If you are comfortable, you can give a bath yourself instead of asking somebody else to come home to give bath to your baby, because as much as you touch the baby, the bond between you and your baby gets better. The process of bathing should not be a very big ritual. You can do a very light-handed oil massage on your baby's skin if your baby's skin is not sensitive. And after the oil massage, you can give any baby-friendly soap bath to your baby, which is for hardly 5 to 10 minutes. After the bath, you can dry the baby, use a very good baby-friendly skin moisturizer, and then wrap the baby, let the baby sleep. In the evening, if the baby is very cranky, then sometimes we also ask you to give a quick bath to the baby in the evening. Sometimes even a warm sponge bath is fine in the evening. But once a day bath in the morning is good enough. So Nisha is asking, my child's skin is very dry. So how should I protect my child's skin? I always say, even if your baby's skin is not dry, you have to get used to using a good baby moisturizer for your baby's skin. Try and make sure that this moisturizer is not oil based, it is aqueous based, because many babies skin accepts the aqueous based moisturizer much better than the oil based moisturizer. There are many pH 5.5 or lesser, which are the moisturizers which are good for the newborn skin, which is very sensitive. If the atmosphere outside is very humid, then you can use the moisturizer only once a day. And if it is very dry, then you can use it twice a day. Someone is asking how long can we massage the baby, until what age? So how long actually only depends on how your baby likes it. There are many times when we say do not massage your babies if your baby is just constantly crying, does not like being massaged. It's okay if you don't massage at all as well. If you want to massage, if the mother is massaging, that is the best. And the mother can massage for about 5 to 10 minutes, very light handed, all over the body. No need to do any rituals of pressing the baby's breast to remove the milk, or pressing the baby's hands and legs very tightly to make them straight. There is no need to change the shape of the nose, or to keep the baby in a completely on the baby's tummy in order to help the baby pass urine or stool. None of these things are required. A light-handed 10-minute massage is good enough. So Uma is asking, can you tell us about the flu vaccine which is necessary to be given every year? Yes, Uma, there was a message which came in the newspapers some time back saying that children should be vaccinated with flu. So here the IAP recommendations, or the Indian Academy of Pediatric recommendations, says that all children less than 5 years and more than 6 months should receive the flu vaccine. Once the first time that you give the flu vaccine to your baby, you need to give 2 doses, 1 month apart, and after that every year, because this vaccine provides protection to your baby only for 1 year. The virus changes in the next year's flu season, and that's why a new vaccine comes up, which most often comes in the season of March, in the month of March and in September. If you take the vaccine which comes in the month of March, it is very effective to protect your baby from flu cases which are on the rise in the monsoon season. So in our country, it's specially advised that you take this pre-monsoon shot for your child once every year for children less than 6 years, less than 5 years. If your child is more than 5 years and has some other problems such as recurrent respiratory infections or asthma or any other diseases which are recurrent, then only your child becomes a high risk, and then he is advised to take the flu vaccine. But after 5 years, most often children develop very good immunity on their own to fight against flu, and therefore it need not be a must. Prachi is asking, how do we take care of diaper rashes? So that is the most common rash that a baby in the first year comes to us with. Many a times the diaper size is not right. If the diaper is very tight, then it's simply the friction of the diaper against the baby's soft skin which causes a red rash. The second common reason is that the baby remains in a soiled diaper, even if it is soiled just with urine, sometimes even with stool, for a long time. The baby's skin is so sensitive that this acidic urine and stool can actually erode the baby's skin wherever it is touching it for a long time. It can cause almost like a wound. The wound can even have some oozing, which is water or blood discharge coming out. And these are all the signs that suggest that probably you have kept your baby in a soiled diaper for a long time. Now, some babies develop diaper rash even if they are not in a soiled diaper. That is when their skin is extremely sensitive. So in those babies, we recommend that you use baby-friendly diapers, the diapers which are medically tested, the diapers which have the inside very soft, and it's friendly with the baby's skin and does not cause any irritation. It does not have any added chemicals such as spirit or alcohol. And use a diaper which has a litmus paper lining inside. The color of this litmus paper changes every time the baby passes urine. So by just looking at the diapers inside, you will know that the baby has, even if the baby has passed a small amount of urine, you will come to know, and then you can change the diaper very frequently. Now, in spite of doing all these things, if your baby still develops a diaper rash, then avoid using diapers for some time completely. A simple langot or a cloth diaper can be used at that time. If the rash is very red, then try and not use any wipes which are alcohol, which have spirit or alcohol in them. Just use a plain cotton which is dipped in warm water and dab the area, and then again use a dry cotton to dab the area dry. Do not rub it too much and try to clean it too much, because that can worsen the skin rash. You can use any nice baby oil or creams which have zinc oxide in them, such as various creams are available in the market, every time before you use a diaper for the baby. After doing all this, the rash keeps on increasing. If there are boils over there, if there is oozing or blood, please reach your doctor immediately. Your doctor will prescribe the right kind of medicines for you, which will take care of this diaper rash and make sure it doesn't worsen. So Lakshmi is asking, doctor, these days my 4-year-old gets mood swings about food and is disturbed due to COVID lockdown. So unfortunately, Lakshmi, I know that we are forcing our kids to stay at home because we are scared that they will get COVID infection if they go out. Now, because of this and because of the lockdown, the most of the children are developing these kinds of mood swings. They are getting very aggressive. Sometimes even not allowing the mothers to not listening to their mothers or the fathers at all. They have even got sleep disturbances, appetite disturbances. They are not able to concentrate in school. So what I suggest is it's a good idea to keep talking to your child. Your child may not be able to go and meet other friends of his age, but you can play with your child. Engage your child in some kind of routine every day. Have a fixed routine. That helps the child develop some kind of a pattern in the whole day where he does not get bored and he knows that he has to do a certain thing at particular time in the day. If possible, if your building has a place where you with your child or just your family can go for a small walk in the evening, do not hesitate. If your child is more than 5 years old, you can make the child wear a mask. Make sure that there is nobody else around you, so that there is no chance that the child comes in contact with somebody who has or might have a COVID infection. Sometimes a quick walk on the terrace also is recommended. So one outing in the day, but making sure that you're not reaching anybody else in that period with your child. And while the child is at home, engaging him in certain activities with good amount of play time and conversation with your child will definitely help you solve this problem. So doctor, how long do I need to breastfeed my baby? Ideally, we recommend exclusive breastfeeding till the baby is 6 months complete. 6 months age complete. After the baby's first day of 7th month, apart from feeding, you can also start with weaning food. But weaning food is only an additional food. And so remember that breastfeeding does not stop after 6 months. You can continue feeding and you have to continue feeding even after that. If there are any restrictions as to in the form of you have to go to work or you are not getting enough breast milk, then at that time we recommend using top feed, which is in the form of powder, and there is a certain way that you have to mix water in it and make a milk which is very close to mother's milk as possible. And only in situations where mother's milk is not available, this top feed can be given. How long can you feed depends entirely on you and on the baby's comfort. Many mothers can continue breastfeeding even up to 2 years of age. But generally, we start trying to tell the mother to stop the night feed. Especially some children have a habit of every time sucking onto the breast before going to sleep in the night, which becomes more like a habit. We encourage the mothers to stop giving this night feed after 18 months of age. And slowly, once you stop the night feed, the day feed automatically comes off. But please remember, when you are trying to wean your child off your breast, at that time, don't introduce the bottle, because then the child loses the habit of feeding from the breast and starts getting addicted to feeding from the bottle. So don't do that. When you're weaning off the breast, you can use a sipper cup, or you can use simply a glass or a katori or a chammach and a katori to feed your child milk instead of using a bottle. So one more question is, will COVID infection spread in elders as well? So basically, COVID is a virus-borne disease. It's caused by coronavirus, which, as you know, is present in the air, airborne spread. So if you are close to a person who has COVID infection, if he sneezes or coughs, then through the air, through the form of droplets, this person can transmit the infection to you. Now, you can be anybody, even a small child or a young adult or an old person. Now, if a small child gets COVID infection, many a times the child may remain asymptomatic, because we have seen that in children, COVID infection is generally not very severe. Now, this child who doesn't have any symptoms, he still has the COVID virus inside him. If he goes close to the other elders in the house, he can transmit the infection to the elders even without having any symptoms. So this is one thing why children are called super spreaders. That is, they can catch infection and spread it very fast and not even suffer. So you may not even know if this child has COVID infection or not. So one thing what we specify generally to all parents is, if somebody in your house has a COVID infection, no need to send your child immediately to some other relative's house or grandparents' house. You can keep the child in your house in another room, because by this time it is very much possible that your child already has the virus in him. He may not have symptoms, but at that point, if you send a child to the grandparents' house thinking that, okay, now I want to protect my child from COVID. No, that is not at all going to happen. In fact, your child might be a super spreader to the relatives or to the grandparents. So keep your child at home in a separate room and use all precautions such as hand washing, sanitizing, and using a mask whenever the child is coming in contact with any other family member who is in contact with the person who has COVID. So that is what we recommend to all. Mona is asking, my daughter is 5 years old. Please help me with weight gain recipe. She's very weak and she does not eat properly. Mona, if she does not eat properly, then I'm sure that your doctor will keep a watch on her weight and her height. If she is according to the standard of the percentiles, the chart that we use for her age, and for her height and weight, then you don't need to give any appetite stimulants at all. You should not be forcing your baby to eat as well, because that generally creates a lot of aversion to food, and the baby will never enjoy her meal, because she always feels that that is the time when she's been forced to eat. Some amount of distraction is allowed, but please do not get into the habit of making your child to sit in front of a TV or a phone in order to feed him food. Regular intervals, frequent meals is what is nowadays suggested for these children who don't like to eat the whole meal at a time. You can give small meals, but more frequently. That works in most of the babies. Many times you also say that try and find out what is it that your child likes and keep the same thing again and again till the child learns to, to start liking to eat food. There is no need to keep too much of variation in food till the child likes to eat food. So if you do these precautions, if you do these changes in your meals, then maybe your child will start eating. And if the height and weight is fine, don't worry about weakness. Weakness is just in the mind, and the child will definitely do what she wants to do at that time. If she wants to play, she will play. Even if she doesn't want to play, then she will show that she's weak. So weakness is not the reason for, but please make sure that the height and weight are okay. Mohit is asking, after bath, my 3-year-old gets reddish. Do I need to change the products or is it normal? So many children after a bath with warm water tend to become flushed. That means they look a little more red. But after they come out and after you have dried the child, then the redness goes away. Then you don't need to change any products at all. But if there is a rash, not only flushing, but there is a red rash on the body after using a specific type of oil or bath soap or shampoo or any cream regularly, then it's a good idea to change to something which is baby friendly and has pH sensitive skin tone in them. Trupti is asking, due to lockdown, it's been 1.5 years of doing online classes. It's online means on the mobile and screens are exposed. So how should I take care of my child's eyes? So unfortunately, there is no solution to it right now. And online classes are required because your child needs to continue school education. What we recommend is that before and after this online class, make sure that you don't again give your child some form of screen. So after your schooling hours are over, then don't give your child a phone to watch or TV serials to watch. So that much amount of screen time is reduced. Plus, we also encourage the child to keep blinking regularly. Many children have a habit of constantly staring at the screen, and that can damage their eyes. So use of frequently blinking the eyes can help. The other thing is, once every year, it is recommended that all children undergo a good ophthalmological examination to make sure that their eyes numbers have not come up. In case there is any chance that you feel that your child really strains very hard to look at small written words or alphabets, or strains to look at the screen, then get your baby's eyes tested. If there are glasses, please start using glasses. The more frequently your child uses glasses, there is a possibility that he grows up, this number will slowly start decreasing. And of course, whenever you're using a screen, make sure you're using the blue filter, which also is known to protect your child's eyes to a certain extent. The other thing that was asked earlier was my baby is very healthy but gets fungal infection due to overweight. How should I protect it and clean it? Andira is asking. So basically, Andira, whenever there are skin folds which are constantly touching each other, in between the skin folds, the skin that is there is sensitive, and if it remains moist either because of sweat or water or sometimes even milk, then that skin, because of being sensitive and because of constant friction between the two edges, can catch a fungal infection. So what we generally suggest is try and keep this area, especially the neck area, the elbows, behind the knees, or at the thighs, wherever the two skin folds are touching each other. Try and keep this area clean and dry. You can also use a good baby powder sometimes, which is useful to keep this area dry. But if your baby still develops fungal infection, then your doctor will prescribe certain antifungal medicines. Only locally application of these medicines is required. Very, very rarely it may happen that this rash is so severe that an oral antifungal might be required. But most of the times this rash gets better when it is kept open, when it is exposed to air, it is kept dry, and when antifungals creams are applied to it locally. So coming to another question. Doctor, my son is 2 years old and he just keeps getting cough and cold all the time. How should I protect him? So generally, common cold it is called common because it is very common. Is known to happen in a lot of children, especially when there is change of weather, or there is, if you have traveled somewhere and come back, or if you have given the child something different to eat, or if there is sudden change of temperature, you move from a hot room to a cold room or vice versa, then these children tend to get a lot of sneezing recurrently. For this kind of cold, which is most often allergic, you don't need to do anything at all. As your child grows older, he will grow off this problem. Some children have a wheezing tendency, that is, they tend to form congestion in their chest because of all these things. So these are children who are allergy prone. And the best form of advice that we give is stop using any kind of very strong perfumes or powders at home. Anything which has very strong smell should be avoided around the baby. Do not use anything which forms smoke. So if there is somebody doing cigarette smoking at home, then please do not do it in front of the baby in the closed environment. Do not use agarbatti or mosquito repellents which can form smoke. Do not give anything to your child to eat which has added colored flavor preservatives. So too many chocolates or drinks which have a powder to be added and which are all artificial. Even things like candy or lollipop are known to trigger this kind of wheezing in children at this age. Generally, children outgrow this problem when they reach 5 years, and most of them completely are off this by 8 years. Unless the wheezing continues for a long time and is very frequent, only then we need to give some long-term medicines to these children. But most often controlling allergy is what helps in these conditions. Also, try and avoid using anything which has on which dust can accumulate in your baby's room. So do not use too many newspapers, soft toys, carpets in your baby's room where dust can accumulate, and the accumulated dust is known to have dust mites, and these dust mites can cause allergy. So there are various other things which also cause allergy which may not be in your control, something like construction going on in and around your building, or on your road, or these are the things which you may not be able to control. There are many viral infections which also trigger allergy. Now that also is not exactly in your control, because viral infection comes from air and somebody else has it, then your child can catch it. So these are the times when you should visit your doctor. Your doctor will give you timely medicines, but please note that it may recur, and therefore there is no need to go doctor shopping, because this is going to take some time to get better. There are no medicines available to cure this problem or this allergy. But as your child becomes older, his body himself is going to learn to take care of this problem and not to respond to allergy by recurrent wheezing. A child's body is going to learn that automatically. Plus, for these children who have recurrent wheezing, it's very important that you give your babies routine vaccinations very much on time. Do not miss any vaccines, because you're protecting your baby from a lot of infections which can trigger a wheeze by giving these vaccines. So this is what I would recommend. So Naina, I think we are done with the questions. I think it was a very interactive audience, and it was so nice to answer all your questions. Thank you very much.